Hi guys, this is Dr. Gonzalez. This is the ethics presentation for Psychology 4371. I've tried to make this a little bit different than the ethics presentation that I do for 4370. So I hope if you've taken my other class, you don't find this terribly boring. If you are taking 4371 and wondering if you're going to have to recomplete the city training, you do not. So without further ado, let's talk about ethics. So it's really important for us as researchers to understand the history of other people's poor ethical decisions. There has been significant research out there that has led to great discoveries, but at the same time, it's also led to discomfort, fear, pain, suffering, and even death. So by acknowledging what's happened in the past, we are training ourselves to avoid repeating history's mistakes, and we're also acknowledging one of the many wrongs that has been done oftentimes to marginalized groups of people. So we're going to start out by talking about several studies that were conducted in the past. And at the end of this video, we're going to talk about how these studies violated some of the ethical principles that are going to be set forth in the Belmont Report. So the first study we're going to talk about was conducted in the 1920s, and it's called the Little Albert Study, and it was done by John B. Watson and Rosalie Rayner. And what they did was they took a baby, Albert, and they taught him to fear a white rat. So at first, the baby was not afraid of the rat, but the researchers went forth and paired the rat with a loud, frightening noise. So the baby sees the white rat, it's paired with this big noise. Now he begins to associate white things, furry things, with being scared from that frightening noise. So after many repeated pairings, Albert started crying when he just saw the rat, and then he eventually generalized that stimulus to other things that were white and furry. And if that makes you go, oh, that's horrible, then hold your horses. The next study I'm going to bring up for you is a study conducted by a psychologist named Myrtle McGraw. And this particular researcher was interested in pain responses and motor development in infants. Infants don't have any way to tell you that they're being hurt other than crying. They don't have words. So her goal was to document how these babies would react to different painful stimuli at different developmental stages. And she conducted these research studies repeatedly. These procedures were done repeatedly. They didn't soothe the babies or the children after they poked them with pins. So to me, this one kind of gets under my skin too, but the next one's even worse. So Wayne Dennis was a researcher who was interested in studying extreme social deprivation on children and their development. So he would go to institutional settings like orphanages where these children were not necessarily intentionally being deprived of social interaction, but because of the way the setting was, they didn't get as much as other children would at home, right? So these children experienced severe isolation. They didn't have any interaction sometimes or minimal interaction with other humans. They didn't play like normal children do, and they just had very little stimulation overall. You can see from this picture here, those babies are just kind of laying there. They don't have anything to look at, no toys to play with. Very sad, right? So his goal was to look at how social and physical stimulation, a lack of social and physical stimulation, affected their motor and cognitive development. And what he found was what you think he would have found. If you deprive children of social and physical stimulation, their developmental milestones like walking and talking are delayed. And so he made the conclusion that environmental deprivation hindered their normal development, and he was right. There are even studies now that show that rats and mice that are kept in cages for research purposes need some sort of stimulation to keep themselves, or enrichment to keep themselves sane. The next study is one of the more egregious studies out there. This is the Tuskegee syphilis study conducted by our own U.S. government, the U.S. Public Health Service. They followed 600 African American men for 40 years. Some of those men had syphilis, some of them didn't. But the goal of the study was to to watch and examine the natural progression of syphilis when it's not treated. The problem was, along the way, participants were not told they had the disease, and even when penicillin became the standard cure in the 1940s, they were not offered that cure. So some participants went on to pass the disease to their wives, and syphilis is a disease that can also be passed to your children through childbirth or in utero. So that was devastating for some of their families. They being the researchers, often misled participants by telling them things like, you just have bad blood. And they did offer some perks. You got some free meals and burial insurance as incentives. But there are long-lasting ramifications of the Tuskegee syphilis study today. And you can go read some of those online. If you Google about the Tuskegee study, you can find plenty of information. The last study that we're going to talk about is Milgram's study. Milgram conducted some experiments to study obedience to authority. And he was inspired by how ordinary people during World War II could commit atrocities during the Holocaust. Like, could they take an active role in participating in genocide in the death camps, such as Auschwitz, and how that obedience to authority plays out. So participants were told they were going to take place in an innocent learning and memory study, and they were going to play the role of the teacher, and they were going to administer these shocks to the learner every time the learner answered a question incorrectly. And in reality, there were no shocks being given, but the participants began to believe they were actually inflicting real pain. And many of these participants started to show visible signs of distress. They were trembling and sweating, and some were even begging to stop. So that's a very brief summary of some of the more heinous research and ethical violations out there. So what happened to change things? So in 1979, we get the Belmont Report, and this was primarily created in response to the ethical abuses from Tuskegee. And in 74, we passed the National Research Act, and that led to a commission whose purpose was to review these historical cases and the current way we're doing research from the ethical perspective, and at the same time to identify ethical principles that should serve as the base for developing guidelines to protect humans and make sure they're treated ethically when they participate in research. So they published the Belmont Report in 79, and it outlined 3 core principles for ethics: respect for persons, beneficence, and justice. Even today, the Belmont Report still serves as a foundation for ethical guidelines used for guiding institutional review boards. The APA also has its own set. If you were in my other class, we covered that in my other presentation. I'm not going to go through it right here. We're just going to hit the Belmont Report. But the Belmont Report is still valid and relevant today, and it influences regulations and practices in human research in the United States and around the world. So what was so important in this Belmont Report? Well, we came up with the 3 core principles of ethics. The first one was respect for persons, which basically means that each individual needs to be treated as an autonomous agent. Autonomous means they act on their own, and an agent means they can take actions for themselves. So we respect people by treating them as people who act on their own and can take actions for themselves. Now, there's also special protections for people who have diminished autonomy. Children, for example, their parents would have to consent for them, and prisoners, because you don't really have a choice to participate if you're in the prison system, although you should, right? So respect for persons means that researchers are required to get informed consent. And at minimum, informed consent needs to talk about the study itself and provide an explanation, outline the risks and benefits, and emphasize that participation is voluntary. Beneficence refers to the idea that researchers have to protect your participants from harm and ensure their well-being. So this means that researchers are obligated to do risk-benefit analyses, and we have to have a clear outweighing of the risks by the benefits. And at the same time, researchers must take actions to minimize any possible harm that might happen to the participant during research. And the third principle was justice, which refers to the fair and equitable distribution of the benefits and burdens of research. So burdens means the same population shouldn't be required or recruited to participate. We need to include all groups of people. And at the same time, whatever benefits come from the research need to be sent out and shared amongst all populations. Justice means that we also have to take careful consideration when we're selecting participants and make sure that we are not targeting vulnerable populations unless that research is going to benefit them directly. Now, institutional review boards, IRBs, play an important part in the research process, especially at the university level. So IRBs are independent ethics committees that review research proposals that utilize human subjects. And they are there to help ensure that those subjects are going to be treated ethically. And it's required by federal law if that institution that is asking to do the research is going to receive federal funding. IRBs are responsible for making sure that all of the risks involved in the study are minimized. They also want to check the informed consent and the informed consent procedures that the researcher intends to use. And they're also going to evaluate how confidentiality and anonymity are going to be protected. And a researcher has to get IRB approval before they can start their study. Now, informed consent was one of those things the IRB is going to be concerned about. Informed consent means that the participant has been fully informed about all aspects of the research before they agree to participate. So that informed consent is usually going to be an actual physical document, and it's going to include a description of the purpose of the research, how long the duration of the research is going to take, the procedures, risks, and benefits. It's going to provide an assurance that the participant can withdraw at any time and that their participation is 100% voluntary. If you've read some of these informed consents before, you'll start to recognize the language in them, and it really reflects what these elements are outlining in this particular slide. So that document typically has to be a signed form. You are supposed to receive a copy of that form, and they're supposed to keep a copy of it. And populations with diminished autonomy, like children, the cognitively impaired, etc., there are special safeguards and guardian consent that will be included in that informed consent. Now let's talk about deception. Deception is something that has to occur sometimes in research, but it is the withholding of information or the presentation of misinformation to your participants. And you can do that by either omitting details, omission, or commission, where you actively mislead your participants. Deception is only going to be permitted in research when it is absolutely justified by the study's scientific value, when there are no other alternatives out there that are feasible for you as a researcher, and the study that you're trying to conduct cannot pose significant risk of harm. Now, all studies that employ deception need some sort of debriefing afterward. That debriefing occurs after the study is completed, and it usually reveals the true nature of the study, explains why deception had to be used and what it was, and it offers psychological support if there is a participant that experiences distress. And we want to do this so that we make sure our participants leave the study unharmed and without being confused. It also serves as kind of an educational moment to increase participant understanding of what the research process is. Now, research misconduct is something that is out there. There is a unit that we do in my other class that talks about some of the more recent stuff that has happened, and it really gets into statistics behind this, but the APA forbids any behavior that is going to compromise scientific integrity, and that includes the three main types of research misconduct. The first one is data fabrication, when you make up data that were never collected. Data falsification, when you manipulate the data, the statistics, or the research process to get a desired outcome. So we're talking about something like harking or p-hacking. And then plagiarism, where you present someone else's ideas, words, or work as your own without proper credit. And it's amazing how things have changed in just 1 year. I'm sure with the advent of AI, we're going to start seeing more of these cases where researchers are falsifying things and using generated data when it really doesn't exist. There's a lot of different consequences that you can experience by engaging in research misconduct. Some of those include the loss of your credibility. No one's going to believe you anymore. Academic penalties, losing your job, and it could include legal action. So animal research is also something that we use in experimental designs. Even if you're using animal research or animals in your research, you've got to follow ethical and legal standards. So committees are in existence at your universities. These are called IACUCs, and IACUCs are the Institutional Animal Care and Use Committee, and they are going to make sure that any research that is taking place with animals is ethical. That includes justifying the use of animals, especially when we use higher order species like primates. It's going to ensure that those animals are treated humanely. That includes housing, food, care. They're going to minimize pain and distress, and we're going to use anesthesia and humane euthanasia when it's necessary. We also want to ensure that our researchers and our staff are trained in how to handle animals properly and the procedures that go along with using them as research subjects. So let's talk a little bit about evaluating risks and benefits. So as a researcher, you have to make sure that when you're selecting your study design, you're evaluating the risks and benefits to your participants. You're going to look at harm, and we're going to look at physical harm, psychological harm, and loss of confidentiality as the three main constituents of harm. You, as a researcher, have to evaluate the probability and the magnitude of the harm that your research participants are going to experience. So what's the probability that they're going to be harmed in this research, and what does that harm look like? Is it just small amounts of harm, or is it the possibility that something is going to be significant in harming them? And you have to weigh that against the value of the knowledge that could be gained. There may be situations where the value of the knowledge that could be gained outweighs the probability or magnitude of any potential harm. But it is up to you as a researcher to evaluate that before the research begins. Now, balancing those scientific value of your research and your participant protection is a complex issue. And it gets even more complicated when you've got studies that involve deception, because deception is a form of lying, right? Using placebos in clinical trials is another one that gets a little gray. And then anytime you're dealing with research involving vulnerable populations. And I want to go back and talk a little bit more about placebo in clinical trials. Some clinical trials may be seen as the last resort for conditions or extending life in a terminal situation such as cancer. So by the nature of including a placebo in your trial, which, remember, a placebo is a condition where the participant does not receive the drug or treatment that we are studying, that in and of itself is a very ticky subject, because a person going into one of these clinical trials may be holding out hope that this is their last option. And so if they are aware that they may not be getting that treatment due to the study being blind, that may affect their decision to participate. And that's something that they need to evaluate, and the researcher needs to be prepared to address as well. So let's talk about those studies we looked at the beginning of this video. And we're going to talk about the ethical violations of each of these studies. And I'm going to ask you in a discussion question during this week to pick one of these and tell me why you think it was the worst. So the first one we talked about was Little Albert First of all, there was likely no informed consent here, although it's not really clear what little Albert's mother knew. It's obvious that this study caused some sort of psychological harm. Now, it's unknown whether or not it lasted the rest of Albert's life, but it deliberately introduced fear in a child, and that could cause lasting emotional distress. Obviously, there was no debriefing and no desensitization, so we basically conditioned Albert to fear these white furry creatures, and at the same time we did not uncondition him and make him not be afraid of those things anymore at the end of the study. And then obviously Albert was a member of a group with diminished autonomy children, and there weren't any efforts to minimize harm or ensure his well-being. Now, the children in isolation study, again, had no informed consent, although some of these children were from orphanages, so that kind of complicates the matter. But it does highlight another vulnerable population, similar to prisoners. Children in orphanages did not consent to being there in the first place. So, this is not a good situation to have no one looking out for these children. There was significant psychological and developmental harm. Now, Dennis himself did not create the deprivation from those severely deprived environments, but he studied it and he didn't do anything to intervene or to make things better when it was done. There was also no debriefing or intervention. It's not really clear to me from what I was able to read about this how long these children were followed up. But they did notice there was a harmful delay in meeting developmental milestones, which at minimum means these children should have received something to help them recuperate those milestones that they had not reached. And this again was another example of a egregious failure to protect a vulnerable population. It was infants and children. They are some of the most vulnerable research participants out there, and no one was looking out for them. The pinpricks in children study, again, there was little information showing any sort of informed consent or any sort of speaking with the parents to tell them the procedures or risks. There was physical and psychological harm. These children were intentionally exposed to a painful stimulus, a pinprick, and there was no therapeutic benefit to it. It was simply to satiate curiosity. This would be considered today what we call unjustified harm. There was no debriefing or soothing provided afterwards. There was nothing provided to make these babies and infants and children feel better after they were pricked. And there was just an utter lack of participant protections. The infants themselves are a vulnerable population, and today's guidelines would require a lot of different extra safeguards to be able to do any sort of pain study that was legitimate with children. The Tuskegee syphilis study, the one that kind of kicked off Belmont, there was a lack of informed consent. The participants were not being told the true purpose of the study. They were told they had bad blood, and they could not give informed consent because they were not told about what the study was doing. There was also intentional harm and deception. There was a treatment for syphilis. Penicillin was proven effective in the 40s, and the researchers knew that it worked, and they withheld that treatment so that they could continue to observe the effects of the disease. And so that caused needless suffering and deaths, not only in the men that were participating, but in their spouses and children. There was no debriefing or treatment afterwards. Their families also did not receive any meaningful explanation or any compensation at the time. And this was another example of the exploitation of a vulnerable population. It targeted poor, uneducated African American men who were taught all of their life to not question white men in authority. And it was believed that they wouldn't understand what was going on, and maybe even the perception by some of these researchers that they were working with people who were subhuman or inferior, which is a horrible thing. And under the Belmont Report's principles of justice and respect, the Tuskegee study was horrible. And as I mentioned earlier, there are long-lasting complications and ramifications even today. There is measurable hesitation to participate in research by African Americans, because why would you if you knew that a group that you belong to had been subjected to exploitation in the past? So I'm happy that psychology is recognizing the wrongs that have been done in the past, but we've got a responsibility to not only apologize for what's happened, but to assure that this will never happen again, and to make up for the wrongs that have been done in the past. Milgram's study was one of the more recent studies. Some of the ethical violations included in this study were that there was deception. They were intentionally misled about the true nature of the study, which indicates they were not fully informed and could not consent because they were not informed about the true nature of the study. And there was psychological harm. These participants believed they were hurting someone else. And so some of them left the experiment feeling very disturbed about the things they had done, and they were just allowed to leave. So that also shows there was inadequate debriefing. So sometimes I understand from what I've read, Milgram told the participants the shock were faked, but they were not fully debriefed, and the follow-up was limited at the time, okay? And there was pressure to continue. There was coercion here because there was an authority figure, the experimenter, and they used scripted prods like you have to keep going, which kind of undermines the idea of I can freely withdraw from this study, which is now a key ethical principle. So I hope that you enjoyed watching this and learning a little bit more about ethics. This is just a very small portion of some of the things that we need to be concerned with as researchers. I highly encourage you to stay up to date about the different ethics issues that are continuing to be brought forth. Ethics is a domain of research that's never going to end. It's not going to say we've reached the best we can do and we stop here. It is a continuous process. And I hope that you take it seriously as you move forward with your role in life as either a producer or consumer of research.